Hi, Stacey here. Today I'm here with Kim. She is a technical vet from MSD and today we're going to have a little bit of a chat about clostridial vaccines and why they're important. So at Farmlands we stock the Multine 5-in-1 range from MSD and we're going to learn a little bit more about how we use those on farm. Now, one of the big questions we get around using clostridial vaccine is why do we need to use them in the first place? Why are they so important?
Yeah, so a couple of reasons. The bacteria that cause clostridial diseases are present on every farm and in pretty much every animal.
Yeah.
And the symptom of clostridial disease is death, right?
Yeah.
So we don't want animals to die and we can't treat a dead animal. So we need to use vaccination to prevent the deaths.
Yeah.
So that's why it's really important that all farmers have a clostridial or 5-in-1 vaccination program on their farm, and a proper program that's set up from the start, like cover the animals for the whole year.
Yeah, so those sudden deaths that we see can be often caused by these clostridial diseases, right?
Yes.
So if we vaccinate, we can prevent a lot of those issues.
Correct.
So why do we need to give our animals a 5-in-1 annual booster in late pregnancy before they lamb or calve?
So for a couple of reasons. One is for the ewe or the cow herself. So she needs an annual booster every year. When that happens, it's kind of, as long as it's within 12 months of the last one, that's great.
Yeah.
But the main reason we do is so that they have protection in their colostrum that they can pass on to their lambs.
Okay.
So giving the ewe or cow a shot will pass protection onto her lamb or calf through her colostrum.
Okay, and will that protection for the lamb or calf last? How long does that last?
Yeah, up to, with, for example, Multine, up to 12 weeks. So we're helping cover that first period when the lamb, before the lamb gets its first shot itself, it's borrowing immunity from its mother by drinking that colostrum.
Yeah.
And it's variable, right? So if the lamb drinks lots of colostrum really quickly and it's a single, then it's going to last as long as possible, 12 weeks, but if it's a triplet that perhaps doesn't drink as much, it might only last 3 or 4 weeks.
Okay, so just the colostrum?
Just the first colostrum, yep.
Yeah.
It's really important that they get that feed really quickly off the mother.
So a pregnant ewe or a pregnant cow has been given their annual booster in late pregnancy, and now they've given birth.
Yes.
When do we give the animals they've given birth to their first shot? Yeah,
cool question.
5-in-1.
So the protection that they get from that colostrum, say we're doing them as on label 2 to 4 weeks before they lamb or calf.
Yeah.
The protection that lamb or calf has got will, as we said, last up to 12 weeks. So what we do is we often come in at tailing for lambs, which depending on how old they are, it's quite variable, but it's convenient to give them their first shot at tailing.
Yeah.
And the label is from 2 weeks of age for lambs.
Yeah.
And then they can have a booster when they're at weaning. Whereas calves, actually on the label says from weaning or 12 weeks of age, which is just a little bit later. That is because the study hasn't been done to say that we can do it earlier. So if farmers or people have questions about doing it earlier, they need to contact MSD and talk to one of the vets and we could give them advice around that.
Perfect. So the animal will need 2 shots.
Correct.
After birth, so they'll need a sensitizer and then a booster to be fully covered.
Very important that they get both.
Yep.
So they use that borrowed immunity from their mother for that short period of time, but their own immune system needs to have a sensitizer and a booster for their full protection to happen.
Yeah, and with like the lamb, so obviously you can use the 5-in-1 from 2 weeks of age. Is there any downsides to using it earlier when they've still got that coverage from their mum?
No, not at all. So if they've got the coverage from their mum and we give them a shot, the vaccine, we've got the trial work to show the vaccine will still act as a sensitizer.
Yeah.
There's no negative effect at all.
So we have the 5-in-1, Multine 5-in-1 at Farmlands.
Yes.
How does that differ from all the other variations? I know that I get confused. There's 10-in-1, 7-in-1. I feel like there's so many variations.
There is. The only number that's missing is 9. So there's a 5, a 6, a 7, an 8 and a 10.
Yeah.
So in New Zealand there's lots of clostridial strains or types of bacteria. The 5 most common, including pulpy kidney and tetanus, are in 5-in-1.
Yeah.
Okay. So in most cases, a complete program of 5 and 1 would be great and will be enough. However, in some cases, you are still getting losses or deaths despite a correct 5 and 1 program. So then we might look at finding out whether it was one of these other bacteria that exists in New Zealand, and there's quite a few of them.
Yeah.
Like a 10 and 1 has the 5 plus 5 extra. And so if we're investigating some deaths that are occurring, we first of all look at the 5 and 1 program, and if that is complete and correct, then we might look at upgrading them. But in general, a 5 and 1 would be a good place to start.
Yeah, so a 5 and 1's going to deal with your problems most of the time.
Yes.
And just sometimes there might be some other variations in there that a 5 and 1 might not be.
Yep, so the first place to always look is at your 5 and 1 program and make sure that's correct and pre-calving or pre-lambing plus 2 shots for the young animals plus annual boosters, which they need every year.